What started as a friendship between Malaysia, Singapore, and the Philippines has now evolved from ASEAN to Asian, and who knows, maybe in the future it will be called Global Collaboration for Trauma. At this point, we'd like to thank all our speakers and panel of reactors who have shared their talents and expertise in this historical 10th anniversary webinar. We'd like also now you to again encourage our participants to type your questions in the chat box as we go through the open forum. And to help us in the open forums, the chair of the Education Committee of the ACT and the chair of the Academy of the ACT, Dr. Amit Gupta. Together with him is Dr. Raj Menon, the Vice Chair of the Education Committee and Scientific Program and co-director, Dr. Amila Ratnayake, the Scientific Program Coordinator and Chair of the Research Committee of the Asian Collaboration for Trauma. We will now have our open forum.
Thank you very much, Dr. Alfonso, Tanak, and Dr. Naren for moderating the webinar. This is the 10th anniversary webinar of the Asian Collaboration for Trauma. It's a webinar of celebration. It's a webinar celebrating collaborations between nations, between societies, between people, between like-minded trauma professionals, not only from Asia, but from around the world. And I think what befitting webinar it was that we had the founding chairman and founding co-chairman opening up the webinar, Dr. Teddy Argoza and Dr. Ismail Saboon. And we also had a galaxy of speakers and reactors from the world. They're all champions of collaboration. They've been doing collaborations, international collaborations for a very long time. And I think very aptly when you describe collaboration, one of the principal Hindu texts from India, the Hindu text, the Bhagavad Gita, the Lord Krishna says, Vasudhaiva Kutumbakam, which means the world is my family. And actually, this was written, I think, tens, thousands of years ago, but it still is a fact that until and unless we consider the world as our family and we are ready to sacrifice our silos in which we work and collaborate, nothing good can come even in medical sciences. And I think we've seen it in the pandemic, COVID pandemic, where all the scientists, the doctors of the world were sharing information on a day-to-day basis, were collaborating on a day-to-day basis with each other. And I think now, after 2 years, we are seeing the end of the pandemic. And with that, I would just give a brief introduction of what we were being, sort of facing in India. The highest road traffic injury deaths, the highest trauma-related deaths, 400,000 deaths every year. 18% of the world population. We started the trauma care very late in India. I would say, sort of qualified trauma care in terms of trauma centers just about 2 decades back, 20 years back. And we started collaborating because ultimately we had to collaborate. It began with Israel, North America, Shock Trauma, University of Michigan, University of South Florida, where I personally was there. And then it culminated into the World Trauma Congress in 2016. We had very active collaborations with Australia, both Melbourne and Sydney, with George Institute and with the Alfred, Dr. Russell Gruen. And off late, we've had some wonderful collaborative efforts with students from Japan, the trauma fellows from Japan coming to India. After all, we've got tremendous numbers, more than 6,000 major surgeries and admissions in a single trauma center in New Delhi. Then we had collaborations in Asia also, especially Thailand, Konkan with Dr. Vidya Chandrachachai, and finally culminated into India joining the Asian Collaboration for Trauma, although late but not the least. It has been a wonderful experience for all us Indian trauma care professionals to be a part of this collaboration, and also to be a part of the training and the education which goes on along with this collaboration. I make it a point today to thank all our speakers and all our reactors. And this is what collaboration means. I would, because we do not have any questions from the panelists, but I would ask just one question, and I would request all the speakers and reactors to react on that particular question. We know education and training, we know we can mix, mingle, we can go to other places. Finances are something which puts us back to go to other countries. You know, not all Asian countries are that rich that they can afford, or their scientific bodies or institutions can actually fund such collaborative, a mixing of students. I would like to know from each and every speaker and participants, what are your thoughts about financing of these collaborations in terms of teaching and training? Could we have a sort of a central fund in the Asian collaboration for trauma? Could we have some sort of a, we are networked, we know each other, and we can easily facilitate the other aspects of training with each other. The main problem is actually the finances. The cross-cultural learning, we all know, is great. What I wanted to know was that if we want to take any message from this webinar, it is about sending our fellows to each other's countries to enrich their clinical experiences, to enrich their cultural experiences there, to have networking. But how do we go about it? So I think I'll begin with the founder chairman of the ACT, Dr. Terry Harboza, who is also my mentor and teacher. Dr. Harboza, what are your views about it? Just in about a minute or two, and then we move on to Dr. Ismail, and then our current chairman, and then Dr. Minter, and then all the speakers.
Oh, thank you very much for recognizing a lot of all these efforts in the different Asian countries. I think the diversity of our health systems are ones that actually unify us. Actually, when we discuss having common goals of saving lives that are of our patients with trauma, I think the diversity in how our systems are evolving into the different stages there are definitely lessons learned from each and every country, each and every trauma surgeon, as we talk to each other and communicate. Trauma is complex. I mean, it's public health. You heard our speakers talk about politics, about public health, human behavior, and the solutions therein are multifactorial, and sometimes it's all about the whole of society. So it's really very important that we all come together in this global village. All the different perspectives put together always enriches each and every one of us. And I think this is what you have done. I tip up my hat to you as part of the education committee, that you've been able to actually do all of this via this format via Zoom. We've enriched each other's experiences, even if we don't physically meet. I was in that era a decade ago where we were thinking of regular meetings in each country, and we were already starting it. But I think this format has actually what we call this hastened enzymatically this particular collaboration. I think this collaboration of ideas in trauma is very important, and I see a very bright future. Even in my country, I now chair what is called a Philippine College of Surgeons Trauma Injury Burn Care Commission. So we've now taken in an inclusive approach into trauma, and has involved not only the surgeons, but all other practitioners from public health, from the uniformed services, from rehab, from mental health, and all those other colleagues in emergency medicine and pre-hospital care. So it's become a more extensive system, and we are all learning from each other, because all of us are looking at the same problem in different lenses, and it's collaborations like this that actually give us more wisdom. Thank you, Amir.
Thank you so much, Dr. Harboza. Really inspiring words. I think Dr. Ismail, I cannot see Dr. Ismail here, but I would redirect my question once again to our first speaker. I think Dr. Ian is also not here, but But my same question goes to Dr. Raleigh, who's the current chairman. What do you see in terms of the exchange programs and the financial assistance? Are there any sort of institutions in Philippines where, say, Indian doctors or doctors from other country can come, and what are the sort of avenues of cross-cultural exchanges within Asia? And then I'll come on to the Europe and South Africa also later on.
Thank you, Dr. Amit. Really, one of the problems regarding fellowship training, and especially in other countries, is the financial support. In the Philippines, we have asked for donations from different companies which can support the training of graduates of general surgery into further training in trauma in other countries such as Singapore, North America, and Canada, and Europe, and of course Japan. So that is actually what is hindering the new graduates of general surgery into going into trauma fellowship. And we know that especially specializing in trauma is not, it's more of a profession, it's a vocation, it's something that it is not really financially rewarding, as we would say, but if you, it is more of the a reward on your personality, having imparted your knowledge to and help other the patients who are injured. So I think that is more of the problems that we have to address.
Well, thank you, Dr. Raleigh, for your comments. I think I'll come to Dr. Elvin Stein. She is the president of the YATSE. She is a very prominent trauma surgeon, and she I mean, South Africa has been on the forefront of collaborations worldwide, imparting different courses, and also inviting international fellows to South Africa, both Johannesburg and Cape Town. What has been your experience with the majority of people who've been coming from Asia or from around the world? What did you see were there issues in terms of their financial? Were you supporting, or were they coming voluntarily? Because that's one of the major questions, you know, how to go there. Our students are there, they're interested in coming to all of you for training, but finances are an issue. So were they taking finances from their own country and coming, or were the government funding? What has been your broad experience over the past years, ma'am?
Thank you, Professor Gupta. Good to see you and your students that I recently met. You know, I think that finances is a problem everywhere. We certainly do not have finances to support the visiting students, visiting doctors. And our doctors have no support financially to go elsewhere. So these are our struggles that we all need to find solutions to. Occasionally we have people who are fortunate that they are, that their families can support them, or their wives or partners can support them for a short while. But there's just no system that provides this kind of support on a regular basis. It's really rare. And the only solutions are finding participation in major studies, you know, being funded from a big research project, for example, or coming for very short-term periods, visiting just so that the financial support is still possible from the own university. or their own hospital. I think the majority of people who stay for proper fellowship training are ones who are employed, and then their employer provides that ongoing financial support while they're away, under the agreement, of course, that they will come back and then train others and fill their posts again. So it remains really problematic. I don't think trauma is not a sexy topic for funders. It really doesn't inspire many people to provide money. It's got nothing to do with children or animals, and it is not really something that companies would like to be investing in and to make themselves look good. People just stay away from it. So even if you try and talk to the alcohol industry, they're not particularly keen either in getting involved in sponsorships, because it actually, to them, it feels a little bit like an admission of guilt or involvement. So that too doesn't really work. So ultimately, I think the best option is convincing the particular person's employer that they will actually benefit their society and their hospital if they do have an opportunity to travel and learn. Yeah, but it's exactly the same on our side. We also don't have funding to send our people to where they want to go and learn. And I think ultimately, strictly speaking, there should be some sort of reciprocal arrangement. You know, if we could swap, or at least have a circular swap of some kind and fill each other's positions, that should be a solution. But I don't think we're coordinated enough to get to that point yet. So hopefully one day we can actually do a very direct swap and encourage people to learn more about each other's worlds. Thanks.
I think point well taken, Dr. Sain. I think we need to get together as professionals, probably write up a sort of a collaborative project which we can send to our governments, that we are a group of networked individuals which can provide training and a wide variety of training to our students. All we need is a little bit of money from each other, or from the government, or from private agencies. I think we need to come up and institutionalize our collaboration, so that it makes a good document for the government, maybe for the WHO, maybe for some other funding agency who can later on fund that. And I'll come on to Latin America now. Dr. Tercia de Campos, thank you very much for that wonderful lecture. And I was actually, when you were giving lecture, and we all were imagining a very, very similar situation like yours in India, in Asia, in many of the countries here. I think it's a very, very tough thing. But again, I'll come to the same question. Do you have institutions who would, maybe if they fund themselves, maybe are willing to take up those students as fellows with limited surgical or surgery under supervision, and they can come there and have an exchange program in Brazil?
Thank you very much for the question. We have a very challenging issue here about funding. Actually, we don't have funding at all. Each one has to pay for their own learning process. So industry used to help us, but it's not helping anymore. The employers sometimes they used to help. They are not helping anymore, especially with pandemic. The situation has worsened, and we try to, with the medical societies like Brazilian Trauma Society, to help people in this learning process, giving free lectures, free training, online free training, and trying to facilitate these courses like DSTC. And despite of these problems, I can mention that DSTC is a great success here, and the surgeons pay for their courses to learn how to deal with trauma. That's very interesting and very, I like the situation, because people want to develop the training process, and they have to pay for that. that's what it is here in Brazil.
Thank you, Dr. De Campos. I think just one, running out of time, one response from Indonesia, from Dr. Prasetyo, from Dr. Narayan, if he's here, and from Sri Lanka, either Dr. Kamal or Dr. Amila, as to the training opportunities, even if somebody has money or he can gather money from his government, what are the training opportunities for international fellows, say in Indonesia or in Thailand? Thailand, I know, at least the Concan model I know. I don't know about the place where Dr. Narayan is working right now, whether we can come or send our fellows there. Dr. Ekko first.
Thank you, Dr. Amit. Yes, the problem also not only a financial backup, but sometimes the permission of government. So sometimes it's not to operate, to be an assistant of, to be a surgeon, number one, or secondly, but there is a strictly permission in my country, because there are many watchmen, many permit should be clear up for every surgeon from the other country. That's important for us. That's difficult for us.
Right. Dr. Narayan, if you're there, any permissions needed for coming to your hospital for training?
Actually, yes, we need to get permission from government, actually, and we need to get the examinations. But the thing is, when we do like that, it takes times. So some surgeons make like this, they just come under supervision. So the surgeon who work in the hospital has to be closely monitored and also have to scrub in together when they do the operation, take response for everything. This is the way that we did for people who come from Laos, Cambodia, or even Myanmar, because it's very difficult for them to come and just take examination to pass the license. So we do like that here. So the surgeon here can take the risk, actually, right? Yeah.
Right. Thank you, Dr. Narayan. Dr. Kamal? I think
yes, it's a very relevant question to Sri Lanka at this moment, as you know. So, you know, in the government, there is a program for overseas training for the fellowships, the government funded. Actually, still it is being done, but it's with the inflation and this situation, I'm not able to say the future, but which is very difficult. When they go for the fellowships, the country funded them. So the options we can actually, when there is financial difficulties, the people selected your country most of the time because it is easy to get the training in India and the Malaysia as well. Singapore was option. Actually, Singapore trained about 15 surgeons up to now, but it's still the financial issues when it comes in future, it will be difficult for our country to fund for them. And in a previous ACT meeting, I actually proposed now the exposure and the case load is very high in some countries, even in Sri Lanka in peripheral hospitals. If anyone is willing to get that exposure, not a level 1 trauma care, but it's how to work in the austere environment. That is also a good experience in the beginning as a trauma surgeon. So if someone can address this through the College of Surgeons, then there will be a chance that we can, that is how that we can help. And another thing is I can just tell the other countries, when they have no financial support to go abroad and having these international courses. Now in Sri Lanka, I must appreciate Professor Elmin Stein and Professor Kenneth Buffett. I'm not sure whether they are listening. And they are the people who came to Sri Lanka and started National Trauma Management course. At this moment, it is a very, it is the main trauma training course, basic trauma training course in the College of Surgeons. So under their advice and guidance, we started. And then because it's a trauma is a team, we develop our own course for the nurses. And DSTC is, they are very costly, and there are, because of the animals, there are some rules. So we develop a course called decision-making major trauma. So if you think locally, we can develop their own courses with low cost for this financial issue. And of course, because of the interconnected, our collaboration is there, we can get the help from the others. So that is my suggestion.
Thank you so much, Dr. Kamal. I think we are off time now, and I'll sort of begin to close this open forum with a comment that I think it has been a great anniversary, 10th anniversary webinar with all of us coming together and thinking about collaborating further. I think the low-hanging fruits are in front of us. We all know each other. We all know. We all work in hospitals, and therefore we can facilitate training of our fellows with each other's help. Even if finances are a problem, at least we can begin with those who have got money or who can arrange money from the governments can go to each other's centers and get trained, and then probably we can look at the wider funding issue later on. Thank you so much to all my fellow colleagues here, to the scientific program director, Dr. Chumingturk, who's been not only a champion of collaborations with Asia, with the world. He's a well-known trauma surgeon all around the globe. And he's been guiding us for the past, at least I would say, 1.5 years since the time our active webinar started into our sort of whatever we are sort of doing here. Thank you, Dr. Chumingturk, once again. And thank all the speakers, all the reactors for coming and celebrating with us the 10th anniversary webinar. Thank you so much. I'll close down the open forum. Over to the organizers.